Good morning, this is Natalie Zangon. I wanted to do a video today on anger and reaction and kind of like the emotional the situation of how we react to things when they bother us and they set us off. So people in general were used to children having tantrum, children having meltdowns, children just going into rage when things don't go their way. However, there are many people, even adults, who have things like this, and many of us have lived with it, have seen it, have been exposed to it, whether it's at work, at home, or just in different dynamic. So there is a diagnosis in the DSM called intermittent explosive disorder. So this is kind of like similar to oppositional defiant disorder in children, and then you can see it in adults being called intermittent explosive disorder. These are adults who go into rage and tantrum and anger outbursts and a few episodes per week, and they just go into rage and kind of like have a hard time regulating themselves and go into full force in things that just could be upsetting to others. They go into a full force reaction. So it's very important for people to educate themselves, become aware of it, learn it, understand it. Sometimes they could have this huge outburst and within like 10, 20 minutes, kind of like not even know how did this just happen? Like, why did they become so rageful and got set off? And at times, some of them might have even a remorse for like, I can't believe I just did that. So it's important to educate yourself and learn about it, whether it happens to you as the individual or it's happening to someone you live with. It's important to educate yourself and learn about it, understand it. That most people have a room temp, just like water has room temperature. There's an emotional room temperature that people are in, which they're neutral, their voice is calm, their heart is not racing, they don't have a shortness of breath. That's how the normal way of things are. And when people dialogue and have a conversation, they have a monotone like the way I'm speaking right now. But when you live with people that go into rage, that go into kind of like this anger outburst for conversations you're having with them, they sound loud, they yell, and they would sometimes they might even say like, I don't want anyone to hear us. And it's like, well, then why are you talking like this to me if you don't want anyone else to hear us? If there is a problem with the way you are dialoguing with me and you feel yourself getting worked up and you have a problem for it to be broadcasted on Facebook or anywhere else, then if it's a problem to you, then you need to take a moment, take a break, and continue the conversation later. I'm not saying a cop out. I'm not saying to crawl and not talk about it. I'm saying take a break, be an adult, take a break, and then come back whenever you're more centered. When people are not centered, when they're dysregulated and they're emotionally charged up and having a hard time calming themselves down, it's very, very damaging and toxic to the people who are living with them. We need to learn to be more centered and be more aware of that. We need to understand that even families who have had these type of dynamics, the only way you're going to change it is by educating yourself not to repeat it. People are allowed to have difference of opinion. People are allowed to have disagreement. Husband and wives can look at things in two different angles and perspective. That's healthy, and it's okay to let your children see that. If you're so controlling and want everything to be your way and no other opinion besides you, this is what you're teaching your children also, to be submissive, to be passive, to not exist, to just follow along what the other person says. And that's not healthy. That's toxic. The best way is to create a healthy environment where everyone can exist and have their opinions. And as a family and as a team, work together to come up with a solution. But healthy couples allow the other to also have an opinion. In a healthy relationship, couples dialogue, discuss, and have a conversation and allow a place where they can have difference of opinion. That's healthy. It's good for your children to see you discussing opinions and thoughts in a respectful manner, in a respectful format. Whether you're being videotaped or not, God is watching you. If it's not something you would like to be recorded and shown to other people, then take a break. And when you're more calmer, come back and talk about it. Intermittent explosive disorder, it's a situation where a person is so dysregulated that they have a hard time calming themselves down. and they need to get help for it. There are people who are depressed, but because they act out so rageful and in anger outbursts, nobody knows that the root of their struggle is depression, and the branch of it is anger and rage. And in order not to make your family fall apart, your children to be raised in a toxic situation, you need to get help. Get help for yourself. Find out how you can become more stabilized and a room temperature motion. Your children, your spouse are living with you, kind of feeling like they're walking on eggshells because they're not sure what's going to set you off again. Is that really what you want to be remembered by? And if not, get the right type of help so you could live a life to the fullest with joy, happiness, love, and shalom. That's what our family needs more than anything else. It's not fair to kids or family members to go to sleep tense and scared of what you're going to be set off again. And it's not fair to yourself because every time you have those episodes, your brain is releasing abundance of cortisol and adrenaline in a fight or flight mode, thinking it's in a war zone, and it's toxic for your body as well. So get the right type of help and live a happy life. This is Natalie Zangon. Thanks for watching.